Hi, and welcome back. Today I'm going to talk to you about that lump behind your knee. This is a very common complaint that I get from patients that come to see me in the office. Now, the lump behind the knee is typically called a Baker's cyst, or what we call a popliteal cyst. Interestingly enough, this was first described in 1877 by Sir Morton Baker. And at first, he actually truly thought this was a separate structure or entity behind the knee, like a cyst that you would see in the hand, like a ganglion cyst, or a cyst in the breast, or a cyst in the liver. But in actuality, it's not truly a separate structure, but just more of an outpouching behind the knee. So if your knee is swollen, you may see swelling in the front of the knee. And there's not typically a name given to that. People just say that my knee's swollen or there's water on my knee. But when the fluid, when your knee is swollen, goes out the back, it will form a little cup or a pocket full of fluid in the back, which has been called a popliteal cyst or Baker's cyst. And these can be quite small, the size of a golf ball. People may just notice it incidentally by feeling the back of their knee. Sometimes they can be quite large and they can go from the mid-calf up to the mid-thigh. Now typically there's not much that we do about these, especially if they're small and not symptomatic. But if they're quite large, treatments would include anti-inflammatories, like ibuprofen or naproxen, if there's not a reason for you to avoid those. A compressive wrap, like an ACE wrap, tends to work very effectively, and icing. But the most important reason is why it occurred. The most common reason that we see these is from arthritis, and arthritis will cause inflammation and swelling, which can lead to swelling in the back of the knee. And if the arthritis is severe enough, you may need a knee replacement if the other conservative treatments fail. If you have a meniscus tear, that might cause swelling, and sometimes the meniscus tear can be treated with arthroscopy. And sometimes simple trauma, a fall, a sprain, even a fracture that causes swelling might cause some pain and swelling in the back of the knee. Now, the one time this can be quite scary is if a Baker's cyst ruptures, and this would occur when the cyst gets quite large and the tissue behind your knee starts to weaken, and what can happen is either the cyst ruptures or it will start to leak. And if it ruptures, typically if it was a large lump, you may feel behind the knee and the lump is not there anymore, but this fluid from the knee will leak into the calf, and that can be extremely painful. It will cause swelling. A lot of people rush to the emergency room thinking that they have a blood clot, and ultrasounds of the leg are done and show that they had a ruptured Baker's cyst. And that's the case. The treatment is the same as we talked about before. So it's wrapping the leg, elevating it, icing it. All of this is in an attempt to decrease the swelling, and it also decreases the pain, and then you can use anti-inflammatories. Now, if the pain's severe and the anti-inflammatory pills don't work, then sometimes a cortisone injection may be helpful. So I hope that helps answer a lot of the questions that you might have about a Baker's cyst. There's an information sheet that you can see on my website that goes into this in more detail. And if you like these videos and more, you can always click subscribe and you'll be updated when the next video is up online. So until next time, I'm Dr. Adam Rosen.